Basically, neglected tropical diseases, these are group of diseases and disease conditions. So there are around 20 disease conditions which are clubbed under this specific criteria. And this was coined by WHO when they found that many diseases are there which are not getting proper attention globally. And because they are happening in most tropical countries, so there was a very clear-cut indication that there are people who are suffering and their voice is not heard. So this group was designed, and the reason why we call them neglected is because there is very limited drug and diagnostics which are very accurate and very timely for these diseases. Second, there is very limited advocacy at the highest level about these diseases. Third, there is very less amount of resource available, the financial implication towards these diseases. Out of these group of diseases, there are diseases which can be eradicated, eliminated, eliminated as a public health problem or controlled. So I'll give you a couple of examples. Like for eradication, one disease very common is guinea worm, which is going to be eradicated very soon. On elimination, you must have heard of a disease, leprosy. On elimination as a public health problem, lymphatic filariasis, which we call filaria in India. Then visceral leishmaniasis, commonly known as Kala Azar, rabies, intestinal worms, and then diseases which can be controlled like dengue, chikungunya, snake bite, scabies, tapeworm, and fungal infections. So these are a couple of examples of these tropical diseases which are neglected. And why they are neglected? Because they happen in the poorest of the poor population, which is basically neglected. They don't have voice. We don't have very good diagnostics. We don't have very good drugs for these diseases. And finally, we don't have much financing for these group of diseases. Therefore, we call them neglected tropical diseases, and they do not provide any immediate risk to the developed nation. So these diseases are known as neglected tropical diseases. In the recent past, when the Sustainable Development Goals were being designed, so they had included a couple of diseases, and NTDs were for the first time included as part of Sustainable Development Goals. So now each country has their own Sustainable Development Goals, and as part of 3.3.5, they have to report back how much have they contributed towards the control, elimination, or eradication of neglected tropical diseases. So in terms of the total population globally, around 2 billion people are at the risk of one or the other NTDs. And if you talk about India, there are around 670 million people, roughly half of the Indian population, which is at risk of one or the other disease. And there was a study in 2016, the paper was published, in which they had shown that how India actually is on the top of roughly 12 NTDs globally. Because of our numbers and our socioeconomic condition, we were at the top. And I'm very happy to share that one disease which has become like second, not the top we are at the current time, is Kala Azar, which we are moving ahead in a very positive way towards elimination. So in India, we have 4 states where 54 districts are known as VL endemic districts, and there are 633 blocks. Out of them, only one block was above the elimination target in 2022. So in a way, we are more than 99% successful in eliminating this as a public health problem. And with a vast amount of work done by Government of India, we are hopeful that in 2023, India will be able to achieve this target of elimination of VL as a public health problem. So lymphatic filariasis is another NTD which is rampant in India. We don't see the cases outside. That's why we feel that we are perhaps not having this problem. But let me tell you, 20 states and union territories of India are endemic for lymphatic filariasis. And there are 328 districts which are endemic for LF. And among these, we have only 133 districts which have reached to a level of, they have stopped the mass drug administration, and they are at the level of, validating themselves as eliminated. But rest of the districts are still supposed to do mass drug administration, which is basically, drugs are given to the community, and they are supposed to consume the drugs once a year in those endemic areas. Unfortunately, we have not been able to sensitize the community about this particular disease and the initiatives what are being done by Government of India. So this program started in 2004, wherein one drug known as DEC was given to individuals in those endemic areas. And in 2007, another drug was added known as albendazole. And these drugs were given to everybody except children less than 2 years, pregnant mothers, and individuals who are really sick, too much sick. And if everybody consumes these drugs in those geographies, within 5 years' time, that area will be free of this particular disease. Mosquito bites keep on happening. So it may be a situation there where people are actually having the infection, they are looking normal, but they are transmitting the infection. So just like, if you recall, in polio, we used to say not a single child should be left. Similarly, for lymphatic filariasis, not a single person who is eligible should be devoid of these medications. They have to be taken just once a year. That's it. And recently, a third drug has been added by Government of India, which is ivermectin, which is, we are calling it IDA, or triple drug therapy. If the triple drug therapy is conducted in a geography, it requires only 2 to 3 rounds. That's it. That means in 2 years timeline, if everybody consumes the drugs, we can eliminate this particular disease. In terms of health infrastructure, I think we are fortunate that in India we have a very nice system which starts from ASHA level, then the sub-center health and wellness centers, primary health centers, CSC and district hospitals, and then referral centers, medical colleges. So the system do exist. There is no, problem on the system side. The real challenge is about the prioritization. So, to achieve the goal of control, elimination, or eradication for neglected tropical disease, I think the most important thing is at the highest level, at the policy level. The people who are sitting on the highest, chairs, they need to understand these diseases, because unless they understand these diseases, they will not be able to contribute much. So the advocacy is the most important thing. The second thing is about the finances for the programs, because these diseases happen in the poorest of the poor. So many a times what happens, that unless they have other socioeconomic things improved, these diseases will not go away. Whether we talk about sanitation, we talk about clean water, or housing conditions. So that is the highest policy level, what is required. At the bottom level, surveillance for the diseases is very important. The data system should be strong enough to let us know which are the geographies where the problem is present. And third is whatever is required to mitigate the specific disease. It may be, treatment, it may be preventive chemotherapy, it may be vaccines which are required. So those things should be brought in. So the whole logistics system has to be strengthened in such a way that all the endemic geographies have these drugs or vaccines available at the right time.